I'm Stephen Bayles. I'm a head and neck cancer surgeon at Virginia Mason Medical Center. And I'd like to say that I chose this specialty for a reason, but in actuality, it kind of chose me. My mother was diagnosed with cancer while I was in training that presented in her neck, and that really drove home my reason for becoming a physician and ultimately becoming a head and neck cancer surgeon. Head and neck cancer care, I have found to be one of the most challenging subspecialties that I can be drawn to. We interact completely with the world from our neck up. We're not filming my arm, my leg, my abdomen. We're filming today my face, and that's how we communicate and interact with people. We speak, we talk, we eat, we interact with everyone around us through our head and neck. And the impact of disease processes in these areas are visible to everyone. And so being able to help manage and navigate these types of conditions really is rewarding, and being able to keep people as functional as possible as they go forward with their care. We've had tremendous developments in the field of head and neck cancer care, predominantly on both minimally invasive techniques to minimize our impact and being able to remove tumors, in our use of non-operative techniques to minimize the impact of tumor ablation. As well, our reconstructive armamentarium has expanded leaps and bounds over the couple decades of my career, and our ability to handle challenging surgical defects that are created by needing to remove advanced cancers, our ability to be able to restore people has grown immensely over the last 20 years. And I'm fortunate that as part of our training and my colleagues and the team that we have at Virginia Mason, that we bring every aspect of that care to our head and neck cancer patients. So, Virginia Mason Medical Center, in my opinion, is one of the most comprehensive facilities in the nation. I've had the advantage of working at several preeminent cancer centers in the country, and Virginia Mason's attention and focus globally on the patient experience is really what sets it apart in its ability to take care of cancer patients. We have subspecialists in a team that are dedicated specifically to head and neck cancer care, including our pathologist, our radiologist, our speech pathologist, our nurse care coordinator, our physician's assistants. They all have additional training, not just in their area of expertise, but specifically in head and neck cancer care. And that is quite unique at any cancer center. The fact that we can bring all of these people together around each individual patient's case provides an immense amount of expertise that's really focused on giving them the best outcome as possible. And we've seen that in our numbers. The outcomes of head and neck cancer care at Virginia Mason, particularly with the most advanced cases, is above national norms, and we're very proud of what we're able to accomplish. Patients who come to Virginia Mason with head and neck cancer care can be assured that their case is the most important case in that moment. We have an enormous team of people who are going to address all of the patient's concerns, not just the issues related to their cancer, but things that are honestly just as important to them, because when they leave our organization, they have to go home, live with family, live with community, live with friends, work for a living, and all of those aspects of their life have to completely be taken into consideration when trying to determine the right approach to treating their cancer. Head and neck cancer has multiple treatment options available, some surgical, some radiation, some with combinations of both, and trying to figure out which one is going to give them the best outcome from a survival standpoint, but yet also still allow them all their personal needs being met as they go forward is paramount in our decision making.